Hello, Miss Tran.
Hello, Dang. How are you feeling?
Okay.
Okay?
Yeah.
All right. I just want to give you your kudos for completing that long simulation that we just had and just agreeing for meeting with me right afterwards. Um, I also want to start by acknowledging your efforts so far that you put into preparing for the simulation and for completing your new higher coursework.
Okay.
Okay. Before we begin, I just wanted to emphasize that this is a formative evaluation and is no way punitive. Simulations are meant to be a learning experience, and the feedback that I'll share is aimed at supporting your growth as a nurse. So let's begin by discussing your perspective on how the simulation went.
Okay.
What aspects of your performance do you feel went well?
I think I was able to recognize the symptom of hypoglycemia very well and began an assessment.
Yes, I agree with that definitely. I also think you demonstrated lots of strengths and recognizing the more apparent signs of hypoglycemia, like the shakiness of the patient, their pale expression, and their pale complexion. And I think you collected the basic data quite well independently. That said, I think there were also some areas where additional focus in developing these areas would make a key difference in your performance. Um, you identify some of the key symptoms of hypoglycemia very well, but you did miss some subtle signs like the behavioral changes and the lethargy of the patient, which could indicate that the patient was worsening, right? And that's important to identify quickly. Additionally, you also needed significant prompting, so kind of step-by-step guidance to prioritize these findings during the assessment, which slightly delayed your response time. And for a situation like this, timely interventions are critical for ensuring that patient safety and that we are doing all that we can to prevent further complications is very important. Was this an area you felt you had difficulty in?
Yeah. I think I hesitate a bit with some of the interventions. They feel kind of unfamiliar to me.
Yeah.
I also think I could have done better with communicating with the doctor.
Mm, I see. Yeah, I also saw that you did hesitate a bit with administering the glucagon, sorry. And thanks for sharing that feedback with me. Ensuring timely interventions are essential in our practice, but I can see how being unfamiliar with like the protocols and the procedures can lead to the delay in administration. Though I do want to stress that delaying the administration of the glucagon, especially when the patient's condition has worsened, can impact patient outcomes in real life. That being said, this is the value of simulation because it helps us identify these key areas for improvement. To build confidence, though, I would recommend reviewing the step-by-step protocol that we have and our facility adheres to, and just paying attention to the rationales provided in that document for why we are doing each step of the interventions that we are doing. And we can also, kind of run through it step by step, you and I, in a control environment until it feels more like second nature for you. How does that sound?
That's actually sound fantastic.
Yeah? Okay. Awesome. Perfect. I'm glad you like that idea. And in terms of communication, I think your report to the provider contained some core important information. I think you hit that on the head, but I just think that it just lacked some structuring in general. The SBAR format, which we use, kind of helps you convey this clear and concise message to the provider about the patient's status. This ensures that everyone is on the same page, which is critical in a time-sensitive situation like this one. So I think just practicing using a structured template like the SBAR can really help you organize your thoughts, For example, you can practice summarizing, the situation that we just had in the simulation and 2 to 3 sentences, providing the key background information and making specific recommendations you would think would be helpful for the patient. We can find time later to role play this together if you think that would also help.
Yes, I'm open to that. Thanks for working with me.
Oh, it's no problem at all, Dang. I appreciate your openness to feedback and your willingness to grow. I think with focused practice in these areas, I think you'll become a fantastic nurse. Let's schedule a follow-up session in about a week or so to review your progress and address any additional challenges we may have encountered in the time.
Okay.
All right. Well, thank you for
Thank you.
coming.
Thank you much.